See, you want to have fun at the dentist's office. How cute are these? Dr. B and Dr. Shelley, owners of Magnolia Dental. I am here with Dr. B. Why should people come to Magnolia Dental over any other dentist's office?
First off, we're willing to see patients as our family. We're willing to see them as the parts of our family, like an extended family, where we're able to give them a quality dental care. Pretty much everything, in procedure, everything under one roof. Be it just general cleaning, whitening, implants, root canals, anything all under one roof. On top of that, we're just trying to give an anxiety-free experience to our patients where they can be comfortable. I always hear from the patients they don't like going to dentists.
Most people don't.
They always say that, okay, I'm scared of going to a dentist.
Yeah.
Yesterday I had a patient who said like, I like you as a dentist. I was doing the extraction. She said, I like you. But
I don't like what you're doing to me.
I don't like what you do. I'm like, okay, that's something that we have to change. Like, what's the reason why there's so much indifference towards dentistry? They like my hygienist, but when I go into the chair,
they're like, oh no, they see you coming and they're like,
dentist is coming in, like, okay, that's something. So something needs to change. I guess in 21st century, we have to work on making the dental experience more like an interactive, friendly experience. So we're just working step by step towards that direction.
Why do you think it causes people so much anxiety? Is it because you're getting so personal, or because are they scared it's going to be painful?
I think it's maybe the fear of unknown. When it comes to dental, like people, they're fine of getting their blood work done. They're perfectly fine with that. But when it comes to dental, there's so much unknown that needs to be. And plus the old school concept. Like I've seen patients who are in their 70s, 80s. They see my dentist back in the days would like
pull my teeth out with pliers,
hold me with this thing, and they had a scary experience. That's the thing. Now we have a lot of young families, and we are also bringing a lot of population in the 60s, 70s, and they feel the difference. They see that yes, things were not the same back then.
That's
so
good.
Trying to those things. I think the unknown is kind of that what stresses people out.
Totally.
Okay, what's going to happen?
Right? Okay, well, coming up, we are going to be talking about teeth whitening, getting those pearly whites back into school. I know a lot of teenagers, university students are really getting into the trend, and we're going to be talking about some Invisalign if you want to get your teeth straight without having to wear braces. All of that coming up from Magnolia Dental on Morning Live.
We are done. Here, we're all done. I'll just turn it off. I'll take it off from you. Okay, I will quickly take off this thing out here. And so, how was it?
Totally painless. That's amazing.
Painless. Awesome.
So how does teeth whitening work? And if I was to come in for the full procedure, I know we only had one session, but if I was to come in for all of them, what does that entail?
So typically teeth whitening is a zoom whitening. It's laser-assisted whitening.
Okay.
So we have a specific wavelength of laser with this machine that kind of lightens the molecules of the pigment.
Okay.
So we use a special gel that is photocatalytic. It kind of, the light activates the gel and it breaks down the dark color in your teeth.
Okay.
So your teeth get whitened much faster. So typically if the in-home whitening takes like few days, we get the whole thing done in a few minutes.
Yeah, your wife was just saying that it takes, what, 45 minutes for an entire session? You're in the chair for an hour and that's it?
That's it. And then like typically if someone has already lighter shade, it may take only like 15 minutes to half an hour, and that's it.
Wow.
45 minutes is for like really dark teeth when we are actually going to 18 shades lighter.
18 shades lighter.
So like we have a whole spectrum.
So you're blinding people with your teeth at that point.
So typically that's the thing. Like we get like, it's so good like that the results last for around 2 to 3 years, and you get like an instant whitening within like an hour. We call it whitening in an hour. But like someone going for a wedding or like
a vacation or anything, because people smile. People take their smile for granted, and the smile is generally the first impression.
It's the first thing. Like there's a meme that shows that someone missing with an eyebrow or maybe missing a tooth. The tooth is more noticeable.
Totally, missing an eyebrow.
Basically, teeth are like the first impression that you give to someone. But these are some easy tools. Like we do a lot of cosmetic procedures, but whitening is our top notch on that. Like
Yeah, I
within
bet.
45 minutes, we can make a huge difference in smile. Like you have beautiful teeth, but just making a brush up for that, it makes a huge impact.
So you pretty much just said I have beautiful teeth, but they need to be whiter.
No, but they're already whiter after one session, but still,
Yeah.
like, if we go for the full thing, it would make a huge difference.
All right. Okay. Well, there you have it. Getting your teeth whitened is super easy here at Magnolia Dental. Coming up, we're going to be talking Invisalign. And of course, you can't forget the kids. We're going to talk about kids dentistry in just a few moments. Welcome back to Magnolia Dental. We are scanning Will's teeth because he's just about to get Invisalign. Now, Dr. Shelley, Invisalign is a fairly new technology. It's become really popular, I know, in the last couple of years. Tell me a little bit about it and what it entails.
So this is a new technology, so in which we do digital scan. We do digital scan. We don't have to take all those old conventional physical impressions in which we put a tray into the patient's mouth and patient had a lot of material in their mouth. They feel gagged. They're not happy
Yes,
with those kind of
uncomfortable,
conventional
yeah.
materials. So when patient comes to know, oh, something is going to be in their mouth, they say, oh, no, this is very uncomfortable. So this is a very good technology for the digital scan. Patient can have, patient can see what's going on in their mouth, and we can send directly to the lab, and they can make aligners with the scan. They can
Just
make
from that
night
scan?
guards. Yes, I'll show you the scan here.
Let's have a look.
Yep.
So it is such a, it's totally non-invasive.
Yes,
It's
it's
just like a
non-
toothbrush going in your
Yes,
mouth.
it's non-invasive. It doesn't hurt. It's painless.
Yeah, and then it just goes in. It can take
Yeah.
a full photo, 3D imagery of your teeth, and then that gets sent off to the lab. And then what does the lab send back?
So lab just sent back the aligners.
Okay, let's
night
take a look
guard.
at those.
Okay, so let's see. So this is the night guard.
Okay.
So it's a 3D print with this digital scan.
Okay.
It's very thin, very comfortable as compared to the conventional night guards, thermoplastic ones. So it's made up of nylon, very thin.
That's a night guard?
Yes, that's a night guard.
So tiny.
Yep. And it fits exactly on the teeth.
Okay, and then let's see what the Invisalign actually
Yes.
looks like. Because I know I've seen people wearing them, but I've never been brave enough to be like, can you take
Okay.
them out so I can see them?
Okay, so then it's a good thing. I'll show you. Okay, so this is the top aligners if you see. So you just have to take it like this.
Oh, it's incredible how
Yeah.
thin it is. Okay, now you obviously can't eat anything while you're wearing
Yes,
them.
yes. So you have to take them off when you eat, and after that you just wear them back.
And how
It's very
long does it
easy.
take to like correct your teeth? Does it depend on the teeth?
Yes, so like if we have little bit of movements we have to achieve maybe 7 to 8 months.
Okay.
And if we have a lot of movement which needs to be done, then maybe like 1 year.
Wow, but only in a year. Okay. So there you have it. Magnolia Dental, not only do they do excellent teeth whitening, all your cosmetic procedures that you would need done on your teeth, a regular dentist checkup, but Invisalign as well. Coming up, we'll talk about kids dentistry. Don't go anywhere. Lots more coming up on Morning Live. Well, Dino is a little scared about going to the dentist. And Dino doesn't know how to brush his teeth properly. So Dr. B and I are showing him how to do it. And this is how you mimic the patient's, or the teeth brushing when you have kids in here that are nervous, correct?
Yes, we do. Yes, we do.
So how do you put kids at ease when they come to the dentist?
I think kids are very good patients.
Really?
Yeah, I think they're very good patients. The only thing is the anxiety of the parents when they kind of give it to kids. Okay,
They do.
they kind of use us as the bad guy. Okay, you
Yeah.
know, behave well or we'll take you to the dentist.
Oh, I've never done that. That's a really good idea, though.
No. So that's the thing, because kids actually they have no judgment. They don't really know. They don't have no past experience when they come in for the first time. But when they come to a dentist, if it's a friendly visit, if they have these kind of dinos sitting on them, I've seen the kids. They are amazing. They're the best patients.
Yeah.
They love coming to dentists and they look forward to the next visits and cleaning. So it all depends on how the parents and the families introduce the dentist to them. So the first introduction with the dentist is crucial, like
Yeah.
how it goes. So we try to make it very friendly for them. We have Netflix there for kids.
I know, I love that. I love that you've got televisions
So, like-
on the ceilings.
Yeah, like-
Oh, look, it's Coco Melon. We actually had those guys in our studio
Yeah.
not that long ago.
So,
Such a fan. So the kids come in, they get to lie down in the chair, they get to watch a little Netflix, they get to meet Dino, they get to watch how Dino is brushing his teeth properly, because that's one thing about kids is that they may be great patients, but they may not know how to take care of their teeth very well.
Yes. That's where we kind of introduce them to the proper brushing routine. Like it's just like we use the simple motions, we use them the simple techniques that we tell them how to brush the teeth, and then they can kind of make it a habit. Like bedtime brushing is most important, so they get to know this thing that we are getting in there, that more of a regular habit.
Okay.
Once they're able to make that, it does happen naturally.
Yeah.
Because they like brushing the teeth.
Of
after
course,
that.
and well, especially if you make it fun for them. I used to bribe my kids with Smarties, but I'm not telling you that because you're a dentist. But that's how I used to bribe my kids to brush their teeth. Okay, I have been an excellent patient, have I
you were.
not?
Yes, you were a great dentist, like great kid here today.
Okay, so now what do I get to do if I was a great kid?
So now we have this thing for you. You just have to write your name here.
Okay.
And we're gonna put your name on the smile tree. We have a smile tree there for all the kids who have been good patients.
I get to put my name on.
Yes.
Okay, what if you're a bad patient?
No, you still get to.
You still get to put your
Because you're
tooth on here.
Being here is the first big step.
How do we put it on? I guess I'm gonna have to tape it, but if I was to pick a spot,
Yep.
I think I would pick right here.
That's a perfect spot for you.
Right here in the middle. And not only do I get to put my name, what do you call it, the tooth tree?
Tooth tree, yeah.
The tooth tree. I'm
the
going to
smile
take this
tree.
back for a minute. I get a treat in
Yes,
the
you
front,
do.
don't I?
Yes, you do. We have a.
I was an excellent patient, ladies. Do I get a treat?
Yes, you do.
Yay! Honestly, as a kid, this was my favorite part about coming to the dentist. Except at my dentist office, it was a treasure box. But this is very similar. So I take one of these.
Yes, you do, and then you insert the token in there. Okay.
Woo!
what do you get?
I don't know. Let's see. Open it. It's not candy, though, is it?
It's not candy. We don't give candies here.
We don't give candy, but we do give squishy slime-looking thing. Oh, it's one of those hands that you throw at the wall.
Oh yeah.
So fun. Well, thank you so much for having us, Dr. B. We've had a
You're
great
welcome.
experience. And give them a call if you need a new dentist or if you want your kids to come and have an amazing experience. Magnolia Dentist
Awesome. Thank
is
you
where
so
you
much.
come.
Thank you.
Ready? Oh.